This podcast is sponsored by Bath Physics Society. Get your physics. I don't know.
Membership today.
We live in a society based on physics.
Yeah. Hello, and welcome to another episode of Nothing Worth Saying. Today, we're going to be talking about the NHS and healthcare. And I was going to make a joke about how we're rather understaffed, but like Boris Johnson, we've pledged to increase the number of staff members, and we have got Marina back with us today.
Hello.
Hello.
Hopefully you can hear her today.
I'll try my best.
Yes, Tom Hawkins, Nothing Worth Saying regular, is away being a football hooligan this week, so he will not be joining us for this rather critical episode. But as well as Marina, I am joined by Tom Marsden and Ellis. We've got quite a lot to get through today, so I'll just give a brief overview. First, we're going to be going over a very brief history of the NHS and how it was founded. We then discuss the crisis it is currently facing and the challenges still yet to come, including everyone's favourite, Brexit, and compare them to the current system and other healthcare systems in place throughout the world. So, like I said, there's a lot to get through today, but we'll get through this faster than you can say A&E wait times. So, to begin with, the NHS was arguably the first universal healthcare system in the world. This has been disputed for some reason, but I could not find any example
No idea.
of a similar system being introduced. So I don't know where it came from that it was arguably the first. But it was founded by Aneurin Bevan, the health minister of Clement Attlee's Labour government in the post-war years, and was formally introduced and launched on the 5th of July 1948. There had been rumblings about a National Health Service system during the war, but obviously with the war going on, these plans were not implemented. With Conservative MP Henry Willink writing a white paper endorsing the NHS in 1944, with the three principles of free at point of use, finance from central taxation and not national insurance, and that everyone was eligible. The main differences with Aneurin Bevan's version were that he didn't think that local authorities could run hospitals. They were too small and they were too hard to manage. So he brought all the hospitals under a single organised hospital service known as the NHS. The NHS Act was written in 1946 and received royal assent in November, and, like I said before, formally launched on the 5th of July 1948. Today, the NHS is 98.8% funded from general taxation and national insurance contributions. In the 2008-9 budget, the contribution of each person in Britain was around £1,980. It is the fifth largest employer in the world and has been copied, or roughly copied, by many other countries since its introduction. So, well, we've got that out of the way. Let's discuss the current problems, of which there are many. The most obvious problem to the NHS today, which you can't go, I don't think, a single day without hearing about spending cuts and austerity. So, I'd just like to open the floor. What do people think of these?
Yeah, I think there's no denying that the NHS has been pretty badly hit by the cuts. Apparently, even Theresa May's pledge of 3.4% spending increase was only going to keep it at current capacity or at the current level of use, whereas there's obviously been consistent issues with it that need to be addressed. So just having it basically stagnate under the austerity period means that there's a lot now needed to do, because the needs of it, or the demands of the populace, have increased over the whole period.
Yeah.
And the NHS spending hasn't increased in line with that.
Yeah, I think it's important to say that when people say the NHS has been cut under the Tories, spending itself, it hasn't actually been cut. It's just the spending itself has been cut.
Yeah.
So UK health spending has historically grown at 3.6% a year, according to the IFS. Who I know Labour have a problem with, it seems.
Yeah.
But however, between 2009-10 and 2018-19, it grew by just 1.3% a year. And I think that's obviously the key determinant of why the NHS is beginning to fail. I think the Nuffield Trust, looked at 10 crucial trends measuring the quality of the NHS. between 2009-10 and 2016-17. And of the targets outlined in 2009-10, of the targets measuring quality, on 7 measures the quality has gone down.
I think one of the important things to note is that during the Blair years, spending levels increased by 6% a year on average per year. And then since 2010, like you said, it's been constrained to about just over a 1% increase per year. So what you're essentially creating is this massive like increase and then just stop. So you're almost like growing out the service, and then you stop the spending, but it's got nothing.
Yeah.
There's nothing there anymore.
Well, for instance, you look at things like, you can see the impact of spending on A&E waiting times. I think the target since mid-2010 was 5%. And this also started earlier. It said that apparently we met that target until about mid-2014.
That was 5% shouldn't be waiting more than 4 hours.
5% shouldn't be waiting more than 4 hours. And we met that target until 2014, and then since then, we've barely met it at all.
Yeah.
And
It's funny because the 2015 target was for 4 years A&E wait times, and that is
4 years.
4 years.
Christ.
Sorry.
That's a long time to wait, isn't it?
4 hours. The 2015 target was 4 hours. So that's not just waiting. That's you get there, you get checked in, you get treated, and then you get sent home or stay overnight.
Yeah.
And that target is now getting scrapped because it just doesn't work.
It's quite ambitious,
Yeah.
isn't it?
It's too ambitious because it doesn't take into account severity, like priority, how busy it's going to be anyway. It's better to measure, to set targets for the individual aspects of a A&E visit. So, you get there and you get, how long does it take you to get checked in? How long does it take you before you're actually seen? Because I don't know if any of you guys have been to A&E recently. I've been twice, not for myself, but with friends in the past year. And both times I was there, I'd say 5 hours at least.
Really?
So,
See,
this is in the middle of the night. Granted, this is in the middle of the night, but, 5 hours is a long time.
Yeah.
Way too significant for what you'd expect. Especially, like, for me, coming from a Spanish point of view, I've never heard anything like that. Especially whenever I had to go to A&E or, like, when we went on our graduate trip. People had, like, serious things happen to them we had to go to emergency rooms for.
Yeah.
Maximum half an hour of wait. In the middle of the night.
I think it's a big thing to do with time. Like, if you go, I went in very early in the morning, see you straight away. But there's also a matter of being a bit of a postcode lottery of where you are seen, and perhaps up north in one in Newcastle isn't as good as one in the southeast where I'm from.
Well, I think also a big issue, like you hear stories about, like ambulance waits, people waiting in ambulances for half an hour before even the ambulance can get them into A&E. And I know that I went recently, again with a friend, and we was going in the afternoon, so it was like 3-4 in the afternoon, and we did only wait 2 hours. So that wasn't too bad, and that was for the whole consultation and then to get out of there. So I guess it does vary massively as to how quickly you are seen. But I mean, that's like what you said before. Like it's a good point, but both of these times that I went, it was at the RUH, the one in Bath.
Oh, really?
Yeah. So I think you definitely do have a point, especially like where you are. If you're in, say, a more rural area, going to a rural A&E department compared to an urban one, while the rural one might be a lot less busy, it'll also be a lot more understaffed, potentially.
I think one of the main postcode lottery sort of things is in children, like mental health support.
Definitely.
So, especially for ADHD, so children suspected of having it, it's just up in the air. It depends on what part of the country you go. Some areas, it's straight away, you're diagnosed with ADHD. Others, it takes months or even, I think it's up to 2 years to be diagnosed, while obviously children's school prospects suffer because they're not...
Yeah, they're not getting any treatment and they're not getting any counselling or anything, They're waiting for 2 years for something that, if they were told straight away, could, alter the course of their life.
I think that a big part of the wait times and things, again, is staffing, like you mentioned at the start. If you look at us compared to Europe, we have fewer doctors and fewer nurses than most of the European countries, because our per capita spending on healthcare is lower than the majority of...
90% of hospital bosses in England fear understaffing in NHS England is so extreme that health of patients could suffer.
Yeah.
And that's basically unanimous, isn't it?
Yeah. And also, I think if you look at, like, for example, there was a study done by the Commonwealth Trust, and what they were saying was actually the NHS was one of the most efficient systems in terms of the spending and its outcomes. It was just, unfortunately, the spending wasn't enough when you compared it to the other healthcare systems. So whether or not you agree with how the system works, and I think there's good reasons to say that it does work, it's just that there needs to be the money there in order to make sure that it's growing, in order to meet capacity.
I think productivity of the NHS is surprisingly high. It runs at 3%.
It's really high.
But that's due to relying on staff going the extra mile, and not due
all
to
the time.
Exactly.
All the time. Like you've got like nurses, doctors, pharmacists, ancillary staff, everyone staying behind after they'll stay an extra hour and a half or whatever to just make sure that they finish everything that they've done for the day. Yeah. Which it sounds like you should be just finishing it in the day. There's a lot to do in a day, especially in a hospital setting. There is a lot to do in a day.
And that was the crux of the junior doctor strike, was the fact that the thing that was being cut was their overtime pay, and they knew that they were going to be working overtime, and it was like, oh yeah, but you'll get a base salary increase, but it was like, well, no, because they're working so much overtime that they just weren't going to be compensated for what they were doing.
Mm-hmm. Junior doctors work a ridiculous amount of overtime. They're like the two jobs. I'm quite lucky that I'm doing pharmacy, to be honest. The two jobs I would hate to do in the NHS because it just looks so tough are nursing and being a junior doctor, because I don't know how they do it, to be honest.
Well, apparently a lot of nurses, according to Chris Hobson of the NHS Providers, he said that a significant number of people within the NHS are leaving to stack shelves in the supermarket rather than carry on working there because the pay is more competitive.
Yeah.
We've seen pay increase capped at 1% a year. And obviously people are thinking, why should I go into this industry? I mean, unfilled vacancies in 2017, it may have changed in 2 years, but it reached record levels of 12%.
Yeah.
So when you see all these pledges about getting more nurses and more doctors, you need to actually incentivize people to go into those industries.
Do we know if that 1% is that above inflation, or is that not above inflation? Because if that's not in line with inflation, then that's real terms of paying.
Inflation's higher than that. So
because that's a pay income. If it's 1% above inflation, then fine. But if it's 1% not account for inflation, then those people are getting a pay cut every year.
Yeah. That's a big thing, actually. In recent years, doctors' pay, I mean, it depends on your role and everything, but has fallen by up to 17%.
Jeez.
I don't know how long recent years is, but I have a sneaking suspicion that 2010 plays a big role.
And you put that in the context of 6 years of training.
Yeah.
To get your medical degree, and then also all the debt that accompanies that.
Yeah. So, like we were saying before, with nurses and doctors, there's not enough of them. Just how many that is, it's quite ridiculous, actually. We are currently short of 43,000 nurses.
Well, I just want to say, I think it's kind of a vicious cycle anyway with the UK, especially with foreign nurses and doctors. Like you were saying, lack of the incentive to even come here to work, especially if you can get a much better treatment and working hours, say, in Norway.
Yeah.
It just doesn't help anyway. And also with Brexit, I mean, just the numbers of people leaving because of just uncertainty.
Yeah, the number of people of nurses from the EEA who are leaving the NHS has tripled since 2016. Which, when you combine it with the fact that we've got a 43,000 shortage, there's no incentive now to do nursing at university because tuition fees, bursaries are being scrapped. Apparently, the gap could increase to 70,000 by 2022, 2024.
But again, I think the main reason why the NHS is struggling, because it is very efficient in its use of medicines.
Very.
It's one of the most efficient health services in the world.
Yeah. We also pay less for the medicines than anyone else because of
we've got significant.
But you also have this agency NICE, which I forget what the acronym stands for, but basically are the ones that approve the kind of medicines the government will pay you to have. I feel like in Spain focus a lot more on more modern treatments that might be more expensive for the government to pay for. Whereas here it's like, if this treatment hasn't shown for sure to be effective, we won't pay it for you.
There's a big thing about cost efficiency here, where, so like, for example, there was the the whole issue with the certain new diabetes medicines, and they didn't introduce them here because while they'd been clinically proven, they weren't cost effective. So, but apparently we have a larger percentage of off-brand, well not off-brand, but we're not using the people who hold the patent for the initially.
We're using a lot. We use generics loads because it's quite simple. If you go to say Sainsbury's and you see Panadol and Sainsbury's own paracetamol, they are the same drug.
Yeah.
And one is £2 and one is 20p.
Yeah.
It's kind of obvious why. So I think the thing is with NICE, I use them a lot in my degree for they provide all the evidence essentially for why drugs are being used, why they're on our formularies. Their evidence base is ridiculously good, and I think that is why we're one of the most efficient services in the world, just because we're using so much evidence to go, well, if this drug is gonna, so there's a thing called like number to treat, where it's like how many people you have to treat for a condition to get a clinical improvement. So say with a stroke, it's how many people do you need to treat with this drug for like one person to not have a stroke within 10 years, something like that. And if it goes, if say one drug is like 1.1 and the other is 1, but the one that is 1 is like £100 cheaper, we won't use the one that's better because, why would you?
So do you think that feeds into why we have higher mortality rates for certain like things like cancer than we do than our European counterparts?
There's definitely a lot less emphasis on like experimental treatments.
Yeah.
At least I was talking to, so my mum works in the pharmaceutical industry, and she's worked in Spain and Norway. She says there's a big difference in the kind of emphasis that's placed on treatments, and treatments provided by the state for patients. So oncology, for example, she works on studies to do with cancer. In Spain, they're much more willing to sponsor an experimental treatment for you than they would be in Norway as well. And the UK is similar to Norway in that sense. I feel like if it hasn't been proven to work, they just won't sponsor it for you. There's people that just can't afford it and obviously won't be able to get treatment for it.
Yeah, experimental treatments here are quite, especially with things like monoclonal antibodies and stuff now, that they're quite, apprehensive to go for them just because of the side effect profile.
It's just a different kind of emphasis though. Yeah. I feel like the UK places more emphasis on kind of clients. Well, I shouldn't say client. Like patient treatment, like upfront treatment, whereas Spain wouldn't. It's not so much as like your experience at the hospital that they care about. It's what treatment are you getting. Yeah. So you might not have as good of like a just day-to-day experience at the hospital with nurses and doctors, but you would get a more experimental treatment paid for you. Does that make sense?
Yeah, that makes sense.
Yeah, but coming back to that, actually, there was a report by the BBC in June 2018, coinciding with the NHS 70th birthday, in fact, that said it performs below average at preventing deaths from cancer, stroke, and heart disease. The report did also then note that there is less funding per capita for our health service, and in fact,
I think it's 30p out of every pound spent on services goes to health.
Yeah.
But I think that the question is, if you've got NICE and the way that we consider which drugs are useful, do we think then that even if there was significantly more funding, that would still affect those rates in a meaningful way? Or
potentially, because we've got the lowest number of doctors, nurses, and beds per capita in the Western world. I think an increase in funding, just to have more staff members, would definitely increase that, because if you've got
the major issue.
Yeah, you've got a lot of people.
70% of NHS bosses, 76% say the major issue with the NHS currently is understaffing.
Yeah,
I think that's the crux of the matter.
You just got people who are overworked, and then because they're overworked, they might make poor decisions, and I think that's where a lot of accidental or preventable death comes from. It's not from what treatments you're using. Definitely that it is sometimes, but a lot of the time now, I think it's just based on the fact that we are just they're just overworked. They're making poor decisions. They're tired, and when you've got horror stories about junior doctors having to juggle just loads of patients because new people come in, some people things happen on the ward. It's never a set day. So if you had more doctors and had more nurses to help with that, you'd be seen a lot. I'd say you see a lot of improvement. GP numbers are a big thing as well. They were supposed to increase by 5,000 by 2020, have actually decreased by 1,200 or 1,600 if you Corbyn. He just, I don't know, different numbers for different people, I guess. And almost half, I think it was about 46% of GPs were planning to quit or reduce their hours due to perilously low morale.
Yeah, well,
according to the British Medical Authority.
I've got stuff from the Medical Protection Society, and it was a study done this year. They found that 52% of doctors feel their work-life balance is unsatisfactory, and 46% feel guilt when they take time off, which is really sad, isn't it, considering it is a job at the end of the day.
But I mean, it's just the industry as well, isn't it? Like, because when you take time off, who suffers is your patients. It's not just like a spreadsheet.
Yeah.
At the office.
You probably see similar things. You probably see similar things in most countries that doctors probably would feel guilty about taking time off. But I guess
it's the same as like a psychologist.
But I guess when you have reduced capacity to take time off anyway, then it'd be difficult. But I think if you look at other systems, like you look at the German system, which is multi-payer, so you have like an insurance system and you pay in and your employer pays in, so it's roughly 15% of your salary, but the employer pays 7% of that. Their system works absolutely fine. Sort of our system, where you've got a single payer and it's funded centrally through taxes, also seems to work absolutely fine. It just seems to be funding is the main issue. Like, we're not spending enough money. Like, Germans are spending more than us on healthcare, and the French have a different system again, which is more similar to ours. But again, they're spending more on their healthcare, and again, they're both meeting the targets of for cancer and for heart attacks and strokes, I think it is. So it just seems to be funding that's the main problem for us.
Yeah.
But I guess, how do you recruit all of these doctors and nurses as well? Can you justify funding that much more for the salaries? Because if you've got to deal with the underlying issue of Brexit and it being a long hours job, because how can you recruit them enough to make the job worth doing?
Yeah.
Well, and you've got to take into consideration other, obviously, services as well. Obviously, health is important, but I think the growth in the National Health Service has led to real problems for defence, whether you say it's important or not, and the housing industry. So the government's balancing a lot on its plate.
Well, so it's general budget deficit at the end of the day.
Speaking of deficit, 2/3 of our hospitals are in deficit.
Yeah.
They run, and a lot of the worry is a lot of the pledges made in the Labour and the Tories manifestos will just go on paying off debt, basically, and it won't go on actual patient healthcare.
Well, do you think then we should have a similar system with regards to the way the Germans work? Is that if you're earning over 68,000 euros, which is quite high, you can opt out of the mandatory health insurance policy and go for private healthcare. Do we think we should be doing more to encourage higher earners to opt out of the NHS and go for a private healthcare system?
I mean, there is private schemes in this country, isn't there?
Sure, but you're still eligible to use the NHS.
I guess it could alleviate some of the just sheer amount of people that are trying to use the NHS, which can help. I'm not sure how people would feel about it.
I think it kind of almost goes against one of its principles is the issue.
Yeah, it's universal.
Because I find the issue with America is there's such a differential in healthcare, and do we really want to create a class differential in healthcare as well as...
Yeah.
But the thing is, so Austria has kind of a similar system to Germany. I don't think if you were to incentivize people who earn above, would you say
68,000 euros.
Yeah. I don't think it would automatically turn into America. Because it hasn't in Germany. I don't feel like. And we were on private insurance in Austria. And the system is so doctors can be at the same time public doctors and private doctors. So they open their clinic hours according to whenever they're being private or public.
But we do have a system of private and public. Are you saying that we just don't advertise private enough?
I think maybe. I think certain things. So for example,
I was private last year with Bupa. I'm sure a lot of people are. My company offered it. My dad is as well. His company offers it. So we do have comprehensive private healthcare in the country. It's just, should we try and...
I think we should encourage people to use that because, for example, for me, I'm covered under my mum's scheme. So my mum gets healthcare through work. I'm covered on it. I think my dad's covered on it as well. So if I had a medical issue, though, my instant reaction would be, oh, well, I need to see my GP.
Why?
Just because that's what you're socialised to do. You would contact your GP, whereas I don't.
You only contact Bupa or things like that because one is quite hard to set up. There's a lot of admin, and whereas NHS is just
you just show up.
Exactly. So perhaps that's a good plan, because the only time I've ever used Bupa is when I've called my GP. They said the waiting time will be this length, and then Bupa's almost the fallback.
Yeah.
Perhaps we should prioritise somewhere like Bupa to be the go-to.
And maybe we should encourage companies to also partially shoulder the burden of that. So maybe we should encourage more companies to provide healthcare to people so that they can, or even possibly supplementary healthcare for certain services. So maybe you would go to the NHS for all your emergency needs, but then certain things you would go through private healthcare. So sort of dentistry, glasses, all that sort of stuff.
Is dentistry covered here in the NHS?
Up until you are 16.
19.
Is it 19? Okay, yeah.
19.
Up until 19.
For Spanish healthcare, it doesn't cover anything to do with dentist.
So I think the same with glasses, actually.
Corbyn's plan was checkups, wasn't it?
That's why Bevan resigned.
Also, isn't prescriptions cost £8.80 in this country?
£9.
It's gone up now.
£9. They are £9. In Wales, they are. Guess how much?
Ooh,
Free.
In
Scotland,
it's evolved. It's devolution, isn't it?
In Scotland, they are
cheaper,
isn't it?
They're not free in Scotland.
But then, what you got to think about that private thing is there's a report saying that the sickest 5% of the population consumes 50% of total healthcare costs.
Oh, sorry, wait, no, Scotland doesn't have it.
Scotland doesn't. It's free.
Doesn't have them anymore. So.
Whereas the healthiest 50% consume only 3%.
Well, yeah, it's like the cost of an 85-year-old to the NHS versus a 30-year-old is 5 times greater.
So perhaps in the pensions, if private healthcare is included, that would lower the cost far more, wouldn't it?
Mm.
So as part of your pension, you still get your private health insurance.
But already you've got issues with how can people live off their pensions at the moment. So I guess if you're adding a healthcare element to that, will a pension be able to cover them and the healthcare? But for a working adult, maybe that they are 5 times less of a burden on the NHS. But as a working adult, you could be funded by your employer.
Yeah, every little helps at this point.
Yeah.
So you may have heard, but there is an election coming up on the 12th of December, and boy, is it a big one. There's 2 big issues here: Brexit and the NHS. We've already kind of talked about Brexit in a previous podcast, so we'll avoid that for now. But first up is Boris Johnson. He's going in hard with some pretty big pledges. He was very proud to announce, in his own words, on the steps of number 10 Downing Street, that he plans to build 40 new hospitals and spend £13 billion in doing this. Some people are quite, let's say, skeptical of it, and say that it's actually going to be 6 hospital upgrades over 5 years, which is quite different. Apparently, the Conservatives, to actually implement this 40 new hospital plan, would have to get in power in the next 2 subsequent elections after this one. There is a £70 million plan to recruit 1,000 mental health nurses in 12 pilot areas, an extra $33.9 billion each year by 2023, 50,000 more nurses and 50 million more GP surgery appointments per year. Now, 50,000 more nurses and I assume more GPs if you're getting 50 million more appointments. Well, how is that going to happen? Because if he's getting an Australian-style point system for his immigration and trying to encourage more nurses, either through training or immigration, that's going to be quite difficult, isn't it?
Sure, well, Australian nurses are 10 out of 10 points, so it's fine. They can come in, apparently. Is that how it works?
I think
every nurse gets 10 points,
I think
and then they get to come in?
What we do have to say is planned investment in the NHS from the 2 major parties are both planning on investing more in the NHS than now.
Yeah.
Which is good, I think. Obviously, the Lib Dems are planning on a budget surplus, which will be interesting to see.
Well, that's real austerity.
That's real austerity.
Real austerity. We
haven't seen nothing yet.
So the Tories hope to train. Their plan is to train more nurses. So they've reintroduced the maintenance grants of between 5 and 8k for students. But these grants were scrapped in 2017, so they're just reintroducing them.
Yeah, it seems like a lot of the policies are fixing
it's like
damage that's already happened.
We've cut something. It didn't go very well. Okay.
But we've also not seen enough detail on a lot of their policies, such as the points-based immigration system. They haven't explained who's getting what points. So is a doctor going to be like 10
They
points?
haven't explained how Brexit's going to happen.
That's also true. That's a minor issue, realistically. But like doctors and nurses, how many points are they? Like, are they going to be encouraged to come in? Like, how does that work?
I mean, I think obviously they're trying to include foreign recruitment, and they claim to try and pursue better policies of retaining nurses. But yeah, I think we need more specifics from them. And also, I think while the grants are being reintroduced, tuition fees are still existing for all these nurses.
Well,
but do you want to go on to?
I heard someone else has a solution to that, don't they?
Yeah, a boy named Mr. Jeremy.
Jezza.
Big Jezza. As part of his £150 billion social transformation, big shiny look at this thing. Can I just say, by the way, when I was looking at these manifestos before, Labour's website is a lot better than the Conservatives.
I agree.
It's terrible.
Much better.
It's terrible.
Okay.
Even with the lack of funding?
Yeah, with the lack of funding.
But at the same time, if you do search the Labour website, for me, the Conservative website came up in an ad.
That's quite funny.
It's just
it's clever.
marketing.
I was like, nice.
No.
Very clever marketing. But yeah, carry on, Jay.
Sorry. So they want to restore public sector pay to at least pre-2008 levels, including adjusting for inflation, and basically it's like an actual real value return to pay. They will do this by having a 5% pay increase per year.
Wow.
Which is
5%.
5%.
Maybe we should get into nursing.
Yeah, I think we should. Increase expenditure across the health sector by 4.3% a year. They want to end and reverse privatisation. And they also want to pledge $1.6 billion a year to mental health services to ensure that access to treatment is on par with that of physical health, which I think is a great pledge, personally.
Definitely.
Mental health is one of the services that was cut most aggressively during the austerity years. So
I think also the important thing is if you look at the top causes of death that are recorded in the UK, it's like suicide is so high up there. And also, if you deal with the issue before it becomes something that you then have to treat, so for example, people who try to kill themselves, you then have to treat them. And so, realistically, if you can deal with mental health effectively, then that'll save money on your investment, in theory.
Yeah, I think overall spending, according to John McDonnell's favourite source, the IFS, spending in 2023-24 would be 2.3% higher under Labour's plans than the Conservatives. However, recent polling has shown that, at the beginning of the election campaign, internal Conservative polling showed that the public trust Boris Johnson more with the NHS than Jeremy Corbyn. Now that's parity. And I think Labour have really pushed the NHS front, and they're claiming that the NHS is up for sale. And perhaps we can see a change of the guard in that Jeremy Corbyn can gain traction through his policies on the NHS. His issue with that is Boris Johnson is still planning on spending a lot of money. So it's whether that washes with the public.
I think my issue with Boris Johnson wanting to spend a lot of money on it is the fact that we've spent 10 years nearly where his government has said, like, oh no, we can't spend any money.
It's not his government.
It's not his government, but the government that he was voting in favour of.
It's important to say
it will be a new government.
But he was an advocate of austerity. So,
it's hard to say his government because the comeback would be, this wasn't my policies. It was Theresa May, David Cameron.
He wasn't introducing them, but he was supporting them. So I think that at that time you've got to say, can you trust him on the NHS when he introduced the policies or he helped support the policies that he's now trying to counteract?
But surely you've got to look to the future and not the past, and look at the manifesto policies. Labour is still spending far more money, it's important to say. What the public will have to decide is whether these spending pledges are feasible.
Yeah, exactly. I think one of the big things that is with both parties is the fact that we've spent all this time trying to cut back on the deficit, and run it up again potentially. So that'll be interesting.
It's also important to note that, again, a lot, as you were saying, a lot of these manifestos, they're very, very vague.
Very vague.
Yeah.
Boris came out with his pledge today to fix adult social care, which is a major issue. It's affected me personally.
Yeah.
I'm sure it's affected a lot of people. But the manifesto basically was saying that to fix that, he didn't give any specifics. He just said no one will have to sell their home to pay for care.
So great.
So what
that
does that
shouldn't
mean?
be happening anyway.
Obviously, it's good. He's right. No one should be.
He's right.
But it's how are you going to make sure of that? Labour's promised a lower target of 24,000 nurses. However, perhaps that's because, they're making tuition fees free, and as well as the maintenance grants.
Yeah, I think with Labour they've got this such a radical manifesto that they in some parts they have to try and at least kind of make it look achievable.
Yeah.
Well, the IFS in particular say it isn't.
Yeah.
However, what Labour voters need to remember and what voters need to remember is even if some of these policies and not all of them are enacted, then that's still
it's still
investment. There will still definitely be an increase in investment in the NHS.
Yeah. We've also, I don't think we've got a fully costed Tory manifesto, have we?
Well, the BBC have said today that it's far less than Labour. It's a gradual, slow change, basically. So it's not in the tens of billions, it's in the billions.
But so we don't have where the money's coming from with the Conservatives, do we? We just have what they're
So Boris has said that today in the manifesto that there will be tax increases.
Okay.
It will just be less compared to Labour, but then that equates to the less spending that the Conservatives
But he's
are doing.
not given us any figures on those tax increases, has he? Or has he just said that there will be some?
He said a little bit more spending and a bit more tax, basically. I've not looked at the manifesto in great details yet, but that is basically so.
Okay.
He isn't planning on increasing taxes, whereas he seems to have U-turned on that policy of cutting them.
It's interesting because I guess it would be interesting to see if he were to fully cost the manifesto, what the IFS would then think of his numbers as well, because it again is a big spend policy, is a big spend manifesto.
It's not a big spend though. It's several billion a year of extra spending, not several tens of billions. So it can be easily, it's more easily costed than the Labour one.
Sure, but again, I guess with the track record so far of Tory spending plans not necessarily coming out as realistic, with the Brexit ones in particular is what I'm thinking of.
Yeah, I mean, they've been stupid. This is a debate for another podcast, but they've been very, very stupid in releasing figures that are not true.
Yeah.
Especially in housing. I think Election Cast, David Blunkett was saying they pledged 260. They've said they've built 260,000 when they've actually built 100,000. Just say the 100,000. That's still
it's still an impressive.
Still improved.
I mean, we haven't really spoken about the Lib Dem one, but again, I guess I don't think, given the legacy of austerity,
budget
and how
surplus
it's
is
affected.
very, very interesting. I haven't looked at their manifesto, but I would like to see what money would be going to the NHS. From
I would be amazed to see how they're going to reconcile real austerity, so a more toughened form of austerity, with the state of the NHS as it stands. I mean, obviously, we need to look at the manifesto to really.
I think the Lib Dem manifesto is a podcast in of itself. To be honest.
I think
Probably.
definitely
That's a weird
next
one.
election is next podcast should be an election podcast.
Ooh,
Yeah.
wow. Ooh.
We're sowing the seed. Sowing the seed.
I just want to make one last point about Labour's plan to reverse privatisation. What do we think? What do we think about privatisation? It's this issue that always gets bandied around of like the NHS is being sold off, it's being privatised, it's horrible. But like, what does it mean? Like, you know, we get told all the time that the NHS is being privatised, but what does that actually mean? Basically, it's just independent providers who, like Virgin Care, get contracts from the NHS and they get paid to do a job that the NHS decides it doesn't want to do it itself.
Yeah.
For various reasons, like cost, or it's just they don't have the resources available.
Isn't
So a
that
private
similar to
company.
Germany?
Yeah, it's multiple providers, private providers, but you have it funded. But I think my skepticism with that is it's all about how you would regulate them, because if you look at what's happened with like nursing homes in this country,
Or Virgin Care.
or Virgin Care itself,
That's a really good one.
like they have. I think it's a failure of regulation. If you're going to privatise, you need to have an incredibly strong regulator with very big teeth, because otherwise you end up with like nursing homes where the costs skyrocket and people ended up like thousands in debt just to live because the costs are so high and the care provided is not to the standard that you would hope.
Mm-hmm. And again, going back to what we said earlier, we don't want it to be a postcode lottery where your position in the country determines what sort of kind of healthcare you get. Yeah. It should be one size fits all.
It should be universal healthcare.
I think it's an interesting. I don't know about how Germany was like that, but perhaps it does work really well. I don't have any figures on that. But as long as we make sure that healthcare standards, as you were saying, remain the same.
Well,
I think it would. I mean, this is still Europe. I feel like there's quite a big consensus on the fact that nobody wants this to turn into America.
Yeah, absolutely.
I mean, we have no figures on how these privatised sectors compare to...
Well, I know that in Germany, for example, the way that it works is that quite often hospitals are very nearly non-for-profit. Like, they make a very, very small profit, and profit isn't necessarily incentivized. So I guess how are you going to create a market that incentivizes people to get into it if the profit motive is very low?
Yeah, I'm sure Virgin would want to try and make a profit.
Exactly. And if you've got a regulator that prevents them making a significant profit while enough that they do it, you look at the collapse of, was it Southwest Rail?
Yeah.
Their profit wasn't there anymore, so they were like, well, we don't want to provide the service. So then who picks up the slack?
Southwestern Rail.
I think that's one of the issues though. Is that there's a very big difference between running trains for profit and looking after people's health for profit.
Exactly. Yeah.
I think
perhaps
healthcare
is a moral argument.
There is, exactly. Healthcare is, in my eyes anyway, is a human right.
Yeah.
Well, I think 87% of the population are proud of the NHS as it is, and that's second to the fire brigade.
Really.
Interesting, but yeah, it shows that it's a much loved institution. We saw the Olympics when we championed the NHS in the opening ceremony. So
I saw that 2/3 of
it is part of what makes you British.
Yeah, 2/3 of people in the country, when polled, apparently said that the NHS was Britain's greatest achievement.
It's quite an interesting cultural thing because I mean, coming from countries that have a very similar system in terms of you don't have to pay for anything when you go in. It's not really just a point of identity for us. It's just a given.
It's because we
pioneered it.
It's because we invented
also,
it.
Fantastic branding. NHS.
Yeah, but I think it's kind of
great
you're
branding.
just raised repeating this.
Yeah.
It is more state than other countries, though, isn't it? It's more state run than.
It's more it's not necessarily more it's more centralised because a lot of it's more regional.
Although it has been outsourced to NHS England, which is basically part of it, but just
NHS England is it's the regulatory body that covers England.
They're completely separate organisations now, really. The Scottish, Welsh, and Northern Irish ones.
They've been separate for a long time. It's just the evolution has maybe forced that further on.
Well, I think that covers everything in a kind of roundabout, rambly way. We will discuss the Americans in a later podcast we've got a while for that. The election is until 2020.
Isn't there a Netflix show?
There is also a Netflix show called The Americans.
Really good, actually.
I haven't watched it.
We will not be discussing that show.
Maybe another podcast.
UK elections got to be the next one.
we've got to have a priority. So stay tuned for that one. We're very excited for it. In fact, we've got to get it out quite soon because we've got less than a month. But thank you for listening to Nothing Worth Saying, and we'll see you next time.